everybody, how are you? I hope you're doing well. Today I have a very exciting topic for you. So, welcome to the channel. For those who are new, my name is Dr. Hilda Nabiswa, aka Diabetesdocke KE. I am a physician and diabetologist based in Nairobi, Kenya. And today I have a lovely guest here with us today. She is going to introduce herself, and after that, we'll tell you what we're going to do.
Hi everyone, my name is Ashley. I am a clinical nutritionist and I'm here to just educate you on how you can prepare your meals at home to promote a healthy lifestyle. Particularly, the meals are recommended for people with diabetes or people who are pre-diabetes or people who are big. Yes.
Okay, so Ashley, welcome to my kitchen.
Thank you.
Now, I will show you the ingredients that I have and what we're going to cook. So this is kunde.
Yeah.
This is chicken. I've just cut it into pieces. I've not done anything else. And then here I have flour. So it's a mixture of millet, sorghum, and maize flour. So what do you think about my ingredients?
Okay, when we do the maize flour that we're going to use today, we have more than 2 cereals in the flour, and sometimes this sort of hinders when you cook the flour. Sometimes the cooking duration of the millet, the sorghum and the maize is different, and also it has phytates in it, and it can block the iron absorption and the zinc absorption in the body. So recommendation is just to use 2 cereals, either the maize and the millet, or the sorghum and the millet, or the sorghum and just 2 cereals. Okay, and
before you move on, what are phytates?
So phytates are antioxidant compounds that sort of bind to the iron so that cannot be absorbed well, or the zinc in the body. So we just recommend people to use 2 cereals if that is okay. You can choose between the maize and the sorghum, or the millet and the sorghum, or the maize and the millet. Okay, good. So should we move to the chicken?
Yes.
Okay, now with the chicken, our chicken is we've chopped it up, and we are going to remove the skin, and we'll show you how to remove the skin so that we do not have too much fat in the meal that we are going to prepare. And for here we have a pre-boiled actually kunde, which we are just going to shallow fry, just to make sure that the taste is good to our palate.
Okay.
Yes.
So let's go ahead then. Let's start chopping things up.
Okay. The skin from the chicken, and now it's ready to be steamed. Reasons why we remove the skin from the chicken is to just make sure that the meat is as lean as possible. Lean meat is just meat that does not have excess fat in it.
Okay, so we get us clear.
Salt is important in our diets because again it's fortified with iodine, and it's also rich in sodium. And the recommended amount when you're cooking is between 2 to 3 teaspoons. It depends with the quantity of the food that you're cooking also. But what we do not recommend is adding salt to the meal after cooking. But when you cook with the salt, it's fine. But the recommended is 2 to 3 tablespoons. That is, teaspoons. So if we are using this sufuria, it's a medium-sized sufuria. We use 1 tablespoon or one teaspoon or 1.5 teaspoon. So if you're going to add the spices are going to flavor up the meal, so you don't have to add too much salt into the meal. That's why we also recommend that people should spice up their meals so that you don't see the need of adding some salt, because in our habits to add salt is because the food is unflavored. So you feel like, oh, let me just add some salt to add flavor in it. That can be counteracted with adding the spices to the food. Yeah.
And remember, Kenya is an iodine poor soil.
Yes.
So because of iodine poor soil, it means we don't have enough iodine in our bodies, and that's why salt is important for us because of the added iodine. So we can put 1 teaspoon?
Yeah, 1 teaspoon.
Okay. So another common question that many people ask us is, what oil should I use? I personally use extra virgin olive oil and some vegetable cooking oil to do my cooking. But what recommendation will you give to a diabetic stroke hypertensive patient regarding oils?
Okay, in terms of oils, we do recommend healthy oils like olive oil. Olive oil, we normally recommend you use it for pan frying and not the deep frying, because the cooking point the smoke point does not support the deep frying. And when you go to the vegetable oil, the normal that is made from the palm oil, it's relatively good. It has less pro-inflammatory factors. Okay. So inflammatory factors are just factors that in an oil that, for example, the vegetable seed oils, like for example, the sesame seed oil, any seed oil that is available in the market, they are high in omega-6 fatty acids, which tend to be very pro-inflammatory, meaning that it will worsen the vascular diseases, which vascular diseases are just the hypertension, the coronary heart disease, and so on. So canola oil also is a very good oil too that you can use. It has a lot of antioxidants that can be beneficial for people with diabetes and hypertension.
Okay, yes. So I always recommend for my patients canola oil and olive oil as the oils that they can use best. So thank you. Let's go on and start cooking.
how we serve it is you use a small bowl, which is approximately 250 ml. If you don't have a bowl, you can use the standard cup to measure your ugali. Then as we plate, the vegetables have to be half a plate, and it should be as much as you would like it to be, but standard it's half a plate. For our protein, we'll serve it on the last quarter of the plate. Yeah, you can serve 2 to 3 pieces of chicken. That will be okay because it will also provide the right amount of proteins at the meal that you require.
Here we go.
So there you go. We have had such a wonderful time with you, Ashley, here today. And I'm sure our viewers have learned a lot from what you've taught us today, how to plate, how to cook, what to use. If you have any questions, please ask them in the comment section below. And I can assure you, we can get you in touch with Ashley. Make sure you support her and try to get to know more about her and visit her at her office. So Ashley, where can we find you?
Okay, on Facebook you can find me at the Nutrition Conversation, and on Instagram it's the Nutrition Conversation.
Okay,
Yes.
so you know where to find her, guys. Support her and make sure you go and just find out what she can teach you in her clinic about nutrition. And remember, nutrition is your prerogative. You are the person who is in charge of your own nutrition. So take that step. Now for me, you know where to find me, guys. This is my YouTube channel. And you can also find me on Twitter and Instagram, Diabetesdocke_KE, and on Facebook, Diabetesdocke. I am really happy to have been with you today, and thank you so much for joining us. Have a lovely week ahead, and God bless you. Bye-bye.